Welcome to another episode of the Xiami Podcast. I'm Alex Frankfort, Communications Manager for Xiami. Today we have with us Director of the Michigan Department of Health and Human Services, Elizabeth Hertel. Director Hertel has had a long and impressive career in the community health services and has been a vocal advocate for child and adolescent health during her time at MDHHS. We're very excited for the opportunity to speak with her today. So Director Hertel, thank you for joining us.
Thank you for inviting me. It's great to be here.
Absolutely. So if you could, begin, tell us a little bit about your role as the director of MDHHS and what that all encompasses.
So as you know, MDHHS covers a broad variety of the services and programs administered in the state of Michigan, from Medicaid benefits to children's services, including all of our public health responsibilities, our state hospitals. So we have a really broad array of projects and programs in the department. It's a lot of fun. It's a great opportunity to see how we can better connect many of those programs and services to better serve our friends and family in the state of Michigan. So it's a great honor to lead this department.
Great. And we were certainly very excited when you got the job. I believe it was last spring. Is that correct?
It was January, I think 22nd or 23rd, but who's counting?
There you go. It's been a blur since, right? Quite a year to take that new position. But we're so delighted to have you. One thing, in its respective to, school-based health centers, in-person learning has returned this fall, mostly around the state. As the kids return to school, what issues are you guys in your department, in your office? What are you looking to kind of, make sure there's a smooth transition for kids going back to school after, was it a year and a half now of, virtual learning in large for most of them? What are you kind of trying to identify or work with schools to make sure it goes well?
Things. First and foremost, we want to make sure that we are providing clear guidance and recommendations to schools on how to best mitigate COVID transmission inside and among schools in the classroom. I think we've been pretty clear and continue to keep our guidance updated based on what we're learning from the CDC, as well as seeing some of the how this new variant, the Delta variant, is acting. We're also very lucky going into the school year this fall that so many of the students who are going back in the classroom are eligible to receive the vaccine. And we know those vaccines are absolutely our best tool in fighting the pandemic. So focusing on keeping kids in the classroom as much as possible this year. And then while they are there in the classroom, we know that this is going to be a transition back into the classroom after a year and a half, like you said, of many students learning virtually or for a very long time learning virtually. And so ensuring that the supports are there inside the school buildings to make that transition as easy as possible for students, whether they feel, anxious or scared, given what we've all experienced throughout this pandemic.
Yeah, absolutely. And so how could the child adolescent health center network, how could they assist the department with those efforts?
The Child and Adolescent Health Center Network has been one of the greatest partners for us in ensuring that kids have access to those sorts of services, especially where they are, right inside the building. I know that is, I think, one of the programs that we partner with so many people to make successful, and that we've really seen so much growth since the implementation of child and adolescent health centers, and the interest by not just schools but communities to have that resource available to them, to their students in the classrooms while they're in school and even during the summer. So that continued development, that continued growth, the focus on how to treat kids holistically while they're there in the school buildings during the school year, and then, again, access to those services throughout the summer as well. So I think that this has been a great partnership. And like you said, I've been a pretty strong advocate for child and adolescent health centers, and I will continue to be, because I think it is one of the best partnerships that we have across the state.
So during the pandemic, maybe very specifically, one of the issues that we're, hearing that kids are having or reporting is a pretty steep rise in the requesting or demand for mental health services as they're coming back to school. We're seeing more kids, disclose that they're, maybe they felt depressed or had different, mental health, issues that they wanted to, were dealing with over the pandemic, and, these different, strictures that were enforced in the last year. What does your department feel like needs to be done to help, remedy that? And how, again, of course, how can, the health centers, assist in that endeavor?
Mm-hmm. Making sure that all of those kids do have access to behavioral health services when they need them is so important. And there are some of those centers who will be able to provide that in person. There are some who can help to facilitate telemedicine visits for behavioral health specialists. But I think if if the center itself isn't able to directly provide those services, and many of them, as you know, are able to work with us to determine how we can facilitate those connections with providers throughout the state. We do have options, and we do have supports that we can make available to students when and where they need them. Again, whether that's in person in the centers, or whether that's working to facilitate some sort of telemedicine relationship. We want to make sure that all kids have access to those services, especially during this time of transition back into in-person schooling.
Yeah. So kind of in addition to that, as we move forward, in the upcoming months, and we see, a lot of what the centers have been doing, maybe outside of their specific purview of, medical care and mental health care. What are, either what you've seen personally, kind of additional services that they've offered kids, or something that, hey, here's an idea that I think CAHCs could really help with as well. Is there anything, kind of that sticks out to you as what they've been doing extra that, deserves to be pointed out as, this is great, keep going, or, here's another area where we could really use your help from the department standpoint?
I think the continued focus on behavioral health services, early intervention to even prevention with kids, especially adolescents, is so important. We know so many mental illnesses can develop during the teenage years, as well as the general, anxiety and stress of being an adolescent or a teenager, and the additional pressures, that many kids may feel today from social media to going, applying for college and making sure that they're in all of these clubs and these sports. And, the pressure is real, and that experience they're having is real. And so being able to teach them and offer them coping mechanisms, and ensuring that they are putting their behavioral health, their mental health first, and making that a priority is really important, I think, both for kids and for the child and adolescent health centers to recognize and continue to support and offer.
Yeah, that's great to hear. Thank you. I suppose before we wrap up here, I kind of got one last question. Moving forward again, I've asked a lot of questions about moving forward, which we're all, eager to do right after the pandemic.
Right.
As we see the light at the end of the tunnel. What are your top priorities as the director of MDHHS? to help us, help the state get through this and then move forward afterwards. What is your kind of strategy and agenda? What do you want to accomplish or see accomplished?
Oh, thank you so much for asking that question. And I think that this whole conversation has really led to very nicely into talking about what some of my priorities are. And one of those absolutely is the continued access and increasing access to behavioral health services, especially with a focus on kids and adolescents, to make sure that they are receiving those services when and where they need them. That we continue to remove the stigma from accessing services for behavioral health, mental health, and substance use disorders, and that we focus on building up an infrastructure in the state that supports the ability of people to access those services. So that's what we've been talking a lot about and focusing on over the last 6-7 months while I've been in this position as director. And I think it's especially important given two really important factors. One, as we move out of the emergency response phase of the COVID-19 pandemic, all of us, every person has experienced this pandemic. We've all experienced it very differently in some instances, but we've all undergone some level of trauma just based on how this experience has played out with, some isolation, fear, anxiety, some people having some economic effects from loss of jobs or that sort of thing. And we'll start seeing that trauma manifesting itself as we move out of this emergency phase. And then additionally, we're getting an incredible injection of funding from the federal government through the American Rescue Plan dollars, and looking at how we can leverage those dollars to help build up that behavioral health infrastructure so that we can have that access for generations to come in Michigan will be a continued focus in the department in the coming years.
Yeah, and I'm sure those talks are early about what that looks like, but is there any kind of sense of, what maybe some of the specifics of building out, that additional, benefits and toolkits and resources for folks will look like?
Yeah, absolutely. We've been able to incorporate some of that even into the fiscal year 22 budget with the financing of community behavioral health centers, the CCBHCs, that offer an integrated clinical care model for people accessing physical and behavioral health services, making sure that we have resources for crisis stabilization across the state through our crisis stabilization units, and continuing expansion of residential options in the community as opposed to having to seek inpatient hospital services for behavioral health. So we are starting those expansions slowly but surely across the state, and we'll continue to work on those and others in earnest moving forward.
That's very exciting to hear. It's truly a great step forward for a problem that, it's so great that we're finally really all in consensus on addressing it, across the aisle, right across the board. So great to hear that. I know a lot of folks in our network will be excited to hear that as well.
Good.
Perfect. Well, I don't want to take up any more of your time. Thank you so much for, speaking with us today, Director Hertel. I know you have a lot of great work to get back to on behalf of all of us. So thank you so much for joining us.
Thank you for inviting me. It's been a pleasure. I look forward to speaking to you again soon.
Absolutely. Take care.